Today we are going to talk about oral systemic health. As dentists, we always think of the mouth as being connected to the rest of the body, but some diseases that can affect your gums, teeth, and mouth may actually have origins outside of your mouth. In this video, we will talk about what these conditions are and how they present in the mouth. Let's start with the cardiovascular system. First is gum disease and heart disease. We have found several studies that have linked periodontitis, which is a severe form of gum disease, to an increased risk of heart attacks. And it is thought that this may be because oral bacteria can make their way into the bloodstream and cause inflammation there. We don't fully understand the connection between the two diseases, but people with periodontal disease do have an increased risk of heart attacks. That's why it's important to treat gum disease. Second in the cardiovascular category is oral bacteria and endocarditis. Oral bacteria and endocarditis. This happens when bacteria from the mouth get into the bloodstream and cause an infection of the heart valves. It usually occurs after some type of dental procedure such as a tooth extraction or a root canal. It is also seen more often in people who have prosthetic heart valves or a history of heart murmurs. Third in this category is inflammation and atherosclerosis. We know that inflammation plays a role in many chronic diseases, including atherosclerosis, which is the buildup of plaque in the arteries. Some research suggests that people with gum disease may also have an increased risk of atherosclerosis. Again, it's thought that this may be due to the presence of oral bacteria in the bloodstream. All right, let's move on to the nervous system. The first topic in this category is oral health and Alzheimer's disease. There's some interesting research that has linked a type of bacteria called Porphyromonas gingivalis, which is commonly found in the mouths of people with gum disease, to Alzheimer's disease. This bacteria has been found in the brains of people with Alzheimer's, and animal studies have shown that this bacteria can cause cognitive decline similar to what is seen in Alzheimer's. It's not clear yet if treating gum disease can prevent or improve Alzheimer's, but it's something that researchers are looking into. Next in the nervous system category is oral bacteria and cognitive decline. While the link between oral bacteria and Alzheimer's is still being studied, we do know that oral bacteria can cause cognitive decline. Several studies have found that people with gum disease are more likely to develop dementia and have an increased risk of stroke, which can also lead to cognitive decline. All right, moving on to the endocrine system. The first topic here is oral health and diabetes. This one is a two-way street. People with diabetes are at increased risk for gum disease, but gum disease can also make it harder to control blood sugar levels, and there's several reasons for this. People with diabetes often have higher levels of sugar in their saliva, which provides a perfect environment for bacteria to grow. They also have weaker immune systems, making them more susceptible to infections like gum disease. And finally, people with diabetes are more likely to have poor circulation, which means that the body isn't able to send enough nutrients to the gums to stay healthy. This can all result in more severe gum disease, and it can make it harder to control blood sugar levels. So if you have both diabetes and gum disease, it's really important to get treatment for both conditions. The next topic in the endocrine category is how blood sugar affects your gums. When you have diabetes, your body struggles to regulate blood sugar, which can lead to high levels of sugar in the saliva. This creates an ideal environment for bacteria to grow, which can lead to gum disease. And as I mentioned before, gum disease can also make it harder to control blood sugar levels. Okay, now let's talk about the reproductive system. First up is gum disease and pregnancy. Studies have found that women with gum disease are at increased risk for complications during pregnancy, such as preterm birth and low birth weight. Again, it's thought that this may be due to oral bacteria entering the bloodstream and causing inflammation. Inflammation is associated with many pregnancy complications. Next in the reproductive category is hormonal changes and oral health in women. Menstruation, pregnancy, and menopause all cause significant hormonal changes that can affect oral health. For example, pregnancy and menopause are both times when a woman's hormone levels drop, which can lead to a loss of bone density and increase the risk of tooth loss. Additionally, hormonal changes can affect the amount of saliva produced in the mouth, which can lead to dry mouth and increase the risk of cavities. Finally, hormonal changes can also affect the immune system, which can make it harder for the body to fight off infections like gum disease. Okay, now let's talk about the skeletal system. First up is osteoporosis and jawbone loss. Osteoporosis is a disease that causes bones to become weak and brittle, and it can also affect the bones in the jaw. If you have osteoporosis, you may be at increased risk for tooth loss, especially if you already have gum disease. The best thing to do if you have osteoporosis is to see your dentist regularly for checkups and cleanings and to make sure to take good care of your teeth and gums. If you do develop tooth decay or gum disease, it is important to treat them as soon as possible since these can worsen the condition of your jawbone. Your dentist should also check your jawbone regularly for any signs of loss or changes in density, since this can be an early warning sign of osteoporosis. Next in the skeletal category is bisphosphonates and jaw necrosis. Bisphosphonates are a class of drugs used to treat and prevent osteoporosis. However, they have been known to cause jaw necrosis in some cases. This is a rare but serious side effect that can occur when bisphosphonates are used long-term. The exact mechanism by which bisphosphonates cause jaw necrosis is not fully understood, but it is thought to be related to the drug's effect on the cells responsible for breaking down bone tissue. This can lead to a disruption in the balance of bone remodeling, resulting in bone death. If you are taking bisphosphonates and develop pain, swelling, or tenderness in your jaw, you should see your dentist immediately. It could be a sign of jaw necrosis. Dentists also need to be aware of this potential side effect and take precautions when treating patients who are taking bisphosphonates. This may include avoiding invasive dental procedures such as extractions or using alternative medications for pain management. Alright, now let's move on to the respiratory system. The first topic is oral bacteria and pneumonia. Pneumonia is an infection that causes inflammation in the lungs, and it can be caused by bacteria or other microorganisms. Oral bacteria are a common cause of pneumonia, especially in elderly or hospitalized patients. These bacteria can be aspirated into the lungs where they can cause an infection. It's thought that oral bacteria are responsible for up to 50% of cases of pneumonia, so it's really important to take steps to prevent pneumonia, especially if you are at increased risk. This includes getting vaccinated against pneumonia and influenza, practicing good oral hygiene, and seeing your dentist regularly for checkups and cleanings. Next in the respiratory category is aspiration risk and oral hygiene. Aspiration happens when food, liquid, or other substances are breathed into the lungs. It can cause a serious lung infection called aspiration pneumonia. People who are unable to swallow properly, such as those with dysphagia or other swallowing disorders, are at increased risk for aspiration. That's why it's so important to practice good oral hygiene, especially if you are at risk for aspiration. This can help reduce the risk of oral bacteria entering the lungs and causing infection. Good oral hygiene also helps keep the stomach acid in the stomach where it belongs. Stomach acid contains a lot of microorganisms that can cause infection in the lungs. If you are at risk for aspiration, you should see your dentist regularly for checkups and cleanings and make sure to practice good oral hygiene at home. Alright, now let's talk about the immune system. First up is oral health and autoimmune diseases. Autoimmune diseases occur when the body's immune system attacks its own tissues by mistake. This can cause inflammation and damage in a number of different organs and tissues. One of the most common autoimmune diseases is systemic lupus erythematosus or lupus. Lupus can cause inflammation in the gums, leading to gum disease. So if you have lupus, it's really important to take steps to protect your gums, such as practicing good oral hygiene, seeing your dentist regularly for checkups and cleanings, and avoiding tobacco products. Another autoimmune disease is rheumatoid arthritis. This disease causes inflammation in the joints, but it can also cause inflammation in the gums. So again, it's important to take steps to protect your gums if you have rheumatoid arthritis. In fact, swollen, red gums are an early sign of rheumatoid arthritis in some patients. Next in the immune category is HIV or AIDS and periodontal disease. HIV or AIDS is a disease that causes the immune system to stop working properly. This makes it harder for the body to fight off infections, including gum disease. People with HIV or AIDS are also more likely to develop other risk factors for gum disease, such as diabetes, and because of that, people with HIV or AIDS are at increased risk for severe gum disease. People with HIV or AIDS should see their dentist regularly for checkups and cleanings and make sure to practice good oral hygiene at home. Some of the complications that can occur in dentistry in these patients can include oral candidiasis, oral hairy leukoplakia, and Kaposi's sarcoma. All of these can be treated by a dentist with experience in managing HIV or AIDS. Now let's move on to the hematologic system. The first topic is bleeding disorders and dentistry. People with bleeding disorders such as hemophilia or von Willebrand disease are at increased risk for prolonged bleeding after dental procedures. This can make it difficult to control bleeding after things like tooth extractions or other invasive procedures. That is why it is important for people with bleeding disorders to see a dentist who is experienced in treating patients with bleeding disorders. You should also let your dentist know about any bleeding disorders you have so that they can take the necessary precautions. Some of the things that your dentist may do include avoiding certain medications that can thin the blood, such as aspirin, and using special techniques to control bleeding. Overall, it's safe for people with bleeding disorders to visit the dentist, but it's important to take the necessary precautions. Next in the hematology category is leukemia and gum health. Leukemia is a cancer of the blood and bone marrow. It can cause an increase in abnormal white blood cells, which can lead to a number of different symptoms. Some of the symptoms of leukemia can affect the mouth, such as bleeding gums, swollen gums, and problems with taste or smell. In fact, oral lesions are seen in over 50% of patients with acute myeloid leukemia. So if you notice any unusual symptoms in your mouth, it's important to see your dentist. Unusual bleeding or swelling of the gums can be an early sign of leukemia. All right, now let's talk about medication and oral health. First up is dry mouth and systemic medications. Dry mouth is a condition that occurs when there isn't enough saliva produced in the mouth. This can lead to a number of different problems, such as difficulty chewing, speaking, or swallowing, as well as increased risk of cavities and gum disease. Some of the most common medications that can cause dry mouth include antidepressants, antihistamines, and blood pressure meds. So if you're taking any of these medications, it's important to talk to your dentist about ways to prevent dry mouth. You can use things like sugarless candy to stimulate saliva production, as well as artificial saliva to keep your mouth moist. Next in the medication category is drug-induced gingival overgrowth. This is a condition that causes the gums to become thickened and overgrown. It's often caused by certain medications such as anti-seizure meds or immunosuppressants used after organ transplant. If you notice that your gums are becoming overgrown, it's important to see your dentist. In some cases, the overgrown tissue can be removed, but it's important to continue taking the medication as prescribed by your doctor. Okay, now let's talk about oral cancer and systemic clues. The first topic is HPV and oral cancer. Human papillomavirus, or HPV, is a common virus that can cause a number of different health problems, including oral cancer. In fact, HPV is responsible for about 70% of oral cancers. That's why it's important for everyone to get vaccinated against HPV. There are several types of HPV vaccines available, and it's recommended that everyone get vaccinated before they become sexually active. Next in the oral cancer category is early warning signs of systemic illness in the mouth. I already talked about how oral bacteria can cause systemic illnesses like heart disease and diabetes, but there are also a number of other systemic illnesses that can cause oral symptoms. For example, celiac disease, which is a digestive disorder, can cause oral lesions. Sjogren's syndrome, which is an autoimmune disease, can cause dry mouth, and liver disease can cause bad breath. So if you notice any unusual symptoms in your mouth, it's important to see your dentist. In some cases, oral symptoms may be an early sign of a more serious systemic illness. Well, that wraps up our list of oral systemic connections. I hope you found this information helpful. If you want to learn more about oral systemic health, I encourage you to do some further research. You can find more information on the websites of the American Dental Association and the Academy of General Dentistry. Thanks for watching, and be sure to subscribe for more dental videos.